Hey, y'all. Welcome back to the Serenity Strong podcast. I'm your host, Shelby Ann. As always, my object is to never tell you how to live your life, is to give you perspectives, insight, tips, tricks on fitness, health, wellness, and now massage therapy. Today, I have my friend Max with me on the podcast. We met through the gym that I coach at, 1031 Fitness, and he is in physical therapy. We just been meshing back and forth on the human body and fitness and physical therapy and how we have been talking about wanting to bring that to you, seeing, the missing puzzle pieces and how you can have the power to, as movie would say, fix your shit, helping you build a stronger, more resilient body, and finally fixing the ailments instead of putting band aids on your injuries. I'm going to turn the mic over to Max so he can introduce himself and give a little background story on how he got to where he is today.
What's up? My name is Max Whitting. I am a physical therapist. I've been since 2017. I graduated undergraduate from Illinois State University in exercise science, roll birds. I went on to Regis University in Denver, Colorado, where I fell in love with the state of Colorado. Um, and it was a very formative experience as far as how I decided I wanted to be a healthcare provider. Um, it's a school that really looks at just people as a whole rather than just their injuries and only just the fixes of injuries. And I learned a lot from some mentors there that pushed me to go on to do a residency, which, less than 10% of physical therapists do, although that number is climbing. And I went on to do my residency at the University of Chicago, and where I became a board certified orthopedic clinical specialist. From there, I had planned on always moving back to Colorado, but sometimes life has uh, other tasks for you. And I was very fortunate to get a job at the University of Illinois Chicago in their hospital outpatient system. And I was working with some of the smartest physical therapists that I think are in the country, let alone just Chicago. It was all fellowship trained and residency trained, and it was an invaluable experience on how much I learned on how to treat patients and persistent pain and looking at different factors that go into that. And it really helped, again, solidify that looking at a human as a whole, but also really helped me kind of peek into where our health system is failing people and where I hope it starts to go. Um, you know, you had told me earlier this week to like think about like, hey, maybe talk about what got you into physical therapy, and I haven't thought about that in a while, and so it was kind of a good exercise to remind me of my why, and I think it's good for people to understand their why of why they go to physical therapy, right?
Mm-hmm.
And so I would say most physical therapists have very similar stories when you're looking at the surface of why you get into physical therapy. There's usually an aspect of I want to help people, and I had a few injuries that really enlightened me about physical therapy. Those are my two big things. That's probably what got me first interested in. I wrestled my entire life. Wrestling was literally my world for 15 years, where it was my identity. Okay. And so when I
Yeah.
couldn't wrestle, it was like, holy crap, what am I going to do here? And
Mm-hmm.
so I had physical therapists that were very helpful in that sense. Also really weird, but the show Scrubs made me want to go into healthcare. Which
Yeah.
is weird to think about, but it was such a good the main character JD really showed his empathy and compassion for helping patients, and I was like, I love that. I want to do that. And from the surface, I was originally going to go to pre-med, and my pediatrician, who I had a very good relationship with, uh, who I didn't realize, spent more time with me to kind of chit chat and help really it really influenced me, was not the norm in healthcare. And so when he was talking to me, he's like, you you like to build relationships. I can tell by the way that we have conversations. Like, you should think about physical therapy rather than pre-med. He's like, if I could do it over again, I would do physical therapy. I'm like, oh, okay. I never really thought about it. I had a physical
Yeah.
therapist and think like, but he pushed me. He's like, you obviously want to work with athletes. Just think about it. And it was something that was a big push for me. And then when I got into PT school, I started to dig a little bit deeper with it and had some experiences as a student. But the big thing was, and if you don't mind me, I'm going to kind of delve a little bit deeper into my own, if that's okay.
Mm-hmm. Yeah,
Um,
absolutely. Because that's the thing is people need to understand that we are still relatable. Like you said,
mhm,
there was a catalyst that got us to where we are today, that got you into physical therapy, that got me into fitness, nutrition, massage therapy. So I feel like it's actually really good that you dive deep into it so people can understand like where you came from and that you're relatable and you saw like a problem and like you wanted to help fix that problem for other people. So absolutely.
for for sure. So sorry if I get a little emotional on this, but when I was in PT school, unfortunately, my brother had passed away right in the middle of my second year. And for the better part of a decade, he was fighting an addiction to opioids. And he was, if you've seen all the opioid docuseries and all that kind of stuff, it was very similar to what my family and I went through. And he was right in kind of the middle of that. So when he was a senior in high school, about 2004, uh, he was at a party, got hit by a car, um, broke his femur, tore his ACL, was basically in a cast for 3 months on top of trying to heal from an ACL. And for those of you out there, that is so hard to come back from if you are in a cast while you're dealing with an ACL for 3 months without getting, like, I'm working on quadricep activation literally the first week of ACL surgery, right? So he already has a hard road coming back from that. And then, if I'm remembering correctly, but I don't remember him ever going to physical therapy, whether that was him or whether that was his uh, physician. I don't know what it was, but he just kept getting opioids, and it was just nonstop. And, um, you know, just like a lot, he was a stupid smart kid. Like, and when I say stupid smart, like, this was a photographic brain. I'll never forget my first day of high school coming in. They're like, "Oh shoot, we got another Whiting. Please don't correct us in the middle of class. Like, we don't need that," because that's my brother just was that smart, right? He just picked up things quicker than anyone. Got a full ride to go to University of Illinois, like, just super genius. And went to school. Uh, Ended up becoming addicted to heroin, like a lot of opioid um, patients end up doing. And eventually he succumbed to that. And so I started realizing how important it is at that point. And I didn't think about this in PT school, but I realized that I really started to work towards those persistent pain patients that I felt very inclined to help them and to help them work towards things that they really care about, whether that's work, whether that's, when maybe they work on the farm. Could just be, I just want to be able to walk, like, a
Yeah.
block without feeling like I can't do that. Whatever it was, it was a those patient those patients are just so I just love working with them because it's you can see things start to click when they realize that their body is more resilient than what they've been told. And it's
Mm-hmm.
not to knock physicians by any means. They're trying to do their job, but I think they're in the business of sickness, and we're in the business of either rebuilding or solidifying, right? And so
Yes.
as I start to look back, I start to realize, like, how much power, and I see this in strength and conditioning coaches as well, or really, really good personal trainers, that they're trying to help people just be better, right? And so I started thinking about it, like, wow, like my brother is the one who got me into weightlifting at a young age. He was a bodybuilder. He was a massive human being at the sprite size of 5'6", and so he was a bowling ball. And so when I was training for wrestling, he's the one who got me into weightlifting. And then I started realizing like how much weightlifting can change your life and improve activity and everything. And then that's what got me into what I wanted to do in undergrad, which was, instead of going the biology route, I went the exercise science route to kind of learn the human body a little bit more, which was I'm so happy I did, because it made my life in PT school so much easier. And then all of my decisions after that, I've come to realize that was based off of the small things that my brother was kind of pushing me towards and teaching me and all that kind of stuff. And it was just a really weird come around moment that I realized, like, it wasn't just because I wanted to help people. It wasn't just because I like the human body, which I do. It's a beautiful chaos. But
Beautiful.
it was to I don't want to see another Andy happen. I want to help people get to the things that they love to do and not feel stuck. And so that's kind of where my growing in this career has gone. And I'm starting to see, even though they may not have the same background as me, I'm starting to see a lot more physical therapists try to go that route, because there's two forks in the road in outpatient physical therapy. There is the corporate setting where it's just churn and burn, and we're just trying to get people to what insurance says they're okay with doing, which typically does not mesh with their goals. Or there now more what we're kind of changing the name to is like performance therapy, which is, hey, we're working towards your goals. We're going to get you to your goals, whether it's the long haul or it's short haul, like whatever it is, we're for you. And that's kind of where I'm at now. I've hit that road. I moved to Iowa/Illinois border to the Quad Cities for my girlfriend as she's in PA school. And I took a job that I knew wasn't really a good fit for me, but I was like, I can do anything for 2 years. And has officially pushed me to kind of now begin my own journey in this world as a business owner and healthcare professional, to kind of hope to change what healthcare looks like in the Quad Cities. I mean, you're at a gym that you don't see gyms like that ever. A decade long is uncalled. Like, you never hear that in a, I don't want to say CrossFit gym, because it's not a CrossFit gym, but in that kind of functional fitness realm, right? And it's because you guys are changing what that looks like and what strength and conditioning looks like for better living. And I'm hoping to establish the same thought process, but in a healthcare sense.
I mean, absolutely. And one, I'm just so sorry that you had to go through that with your brother. I mean, addiction in general is such, I don't know, just like this huge like elephant that you carry around, and that person's trying to battle it, and the family's trying to like help that person, and it just affects everybody. And it sucks that opioids are a huge push. They're the band-aid, they're the pain blocker. It's like cortisone shot on fucking steroids. And then for people to not get that same stimulus, they have to find something that's even heavier and harder, and they can feel it better. That it's that snowball effect. And it's something that too that you and I both agree on, that pain's inevitable. You're going to have some pain through life, whether it's emotional or physical, but it doesn't have to be continual with the physical pain. And I hate so many cliche sayings, is like, I can't think of it now, but it's like no pain no gain, or like never miss a
Yeah.
Monday, or that mentality where it's a grind and you have to keep going and going every day. Like, that's almost on the line of a fitness addiction, is people that think they have to work out 7 days a week. Like, mentally I get it, but change that thought process to maybe a walk instead of grinding your body into the ground, and trying to rest just as much as you play. And a lot of people have a hard time grasping that concept of like, maybe I need to listen to the signals my body is sending me instead of trying to shut them off.
You know,
With the opioids, with the,
yeah.
medicine, with the cortisone shots, with all these cover-ups that you said, like we're not trying to shit on people. We're not trying to sit here and say like, fuck this, shit on this. We're trying to say like, hey, there's two directions that you can go, right? There you can go that direction. It's going to be a quicker fix, it's a band-aid, yes, you're getting some temporary relief, but it's not really fixing the problem. Or you can go this way. And yeah, it might be a longer journey, but now you're really trying to get to the root of the problem. You're trying to actually fix what is causing the pain. And just because you feel pain in your shoulder doesn't mean that's where the pain is actually stemming from. And a lot of people can't grasp that concept. But what they can grasp is, okay, if I go to physical therapy and this person helps me get to the root of my problem, now I have a direction to go in.
Yeah, I am constantly evolving my thought process around pain
Constantly.
and motivation and things of that nature. I come from a wrestling background where it's if you don't do it, then someone else is doing it harder than you, and someone else is constantly working harder than you. And then there's like certain patients where I know I have to put the kids glove on, but at the same time they need a kick in the ass. And it's constantly trying to figure that out for each person. And then pain is such a weird concept because there is some times where you have to use the no pain no gain, and it comes to like when people say that it's, hey, your muscles are sore, you're working hard,
Yeah.
you're pushing your body to near limits. Sometimes you need that, and sometimes the endorphin rush and all that kind of stuff is what gets that kind of, I love that feeling. But then you're exactly right. There's other days where it's like your body's telling you, dude, you need to chill. You're pushing me way too freaking hard. And that's when I'll tell people
Mm-hmm.
those are just our movement days. Like you can still go do work. You just got to do movement. I got to do that for myself sometimes. And
I
it's,
mean, and
it's const,
nobody's like unacceptable to the thoughts, or the
yeah,
feels. Like even a doctor, like they could still get cancer. Like just because and that's like something I thought about too, is like your identity, like just because we're this person, it's not like our entire identity. Like we've dedicated our life to the human body, but there's more to us than that. It's like
sure.
you're not identity to the pain, you're not identity to the wrestling, like you're Max, and you have so many
Hmm.
layers to that. I don't really know where I was going with that, but
I don't
my
know.
tangent I got on.
Motivation.
But
Motivation is
motivation and
weird.
pain, it's different in everybody. It's so different, and so it's like trying to get somebody, like you said, like, yeah, muscles are sore, but if you have like pain, then that's completely different. Like a pain that's like not going away, or your muscles just feel sore and you feel kind of sore when you move them, but then as you start going, that pain starts to go,
And
or that
and
pain
some
starts to go away.
Yeah, and sometimes it's you people just don't, they're ignorant to that, right? They're not accustomed to that. If I work with someone with persistent pain and say I work with a very sedentary 65 to say 80-year-old who's had this freaking knee pain for decades, right? I have to do a lot of teaching, be like, hey, FYI, like I'm not here to take away pain. Okay. That's not what I do, because we need pain. If we don't have pain, guess what? Those people don't typically live a very long life. That's a real genetic disorder that, trust me, you don't want. But a pain is our alarm system, and it tells us when we're pushing to what potentially our body feels like it can't handle. And sometimes it really can handle that. We just don't realize it. Our
Right.
brain is such a good, sometimes it works on overdrive, and we need to give it a little bit of a vacation when it comes to pain. And so when I first get them to say it, just learning, say, I always start with box squats, right? So I don't like calling them sit to stands. Other therapists will call it sit to stands, but I think box squats give you a little bit more of like, I'm not fragile. And
Mm-hmm.
so I'll use those cues, and they're like, holy cow, I was so like in so much pain after last. And I'm like, all right, well, let's dig into it. Like, what was your pain? And they're like, oh God, my thighs and blah, blah, blah. And I'm like, okay, well, that's just, I know that you're interpreting that as pain, but remember, that just means that we worked hard. And that's something you haven't done in a while. I was like, was that your
Hmm.
normal pain? Oh no, then that's safe. Then we're okay with that. And like
Yeah.
remapping how people think about pain typically does not happen. And unfortunately, where
Mm.
our healthcare system is, like a physician cannot dig into that in 7 minutes. I have the fortunate amount of time where it's like 40 minutes is a little less than what I would like to, but the education piece that I can put into 40 minutes is so much more valuable than my actual testing a lot of times, or my actual care that I'm providing.
Yeah.
Because once you get that aha moment in a patient, and sometimes it takes a long time, it's like boom, we got a cascade of like things just fall into place after that.
Right. But the
And
thing that's different about that than like physicians is that you're not like settling at all. Like you're always tweaking and adjusting and figuring out. And even if maybe the movement pattern wasn't there, because that's really what you're trying to do is redirect the movement pattern. And depending on how long you've dealt with it, it's going to take a while to help them kind of retrain or use the muscles like like they should, like how the body should move. And sometimes you compensate. And over the years, the more that you compensate, you're, overworking a muscle than the other one. And that's when those like enamels and injuries can start to happen. And so now you start working, like, say you overuse the right side, but now you start working the left side and you have all this like pain or soreness on the left side. And you're like, well, that's not the same. I'm like, yeah, because you're actually like using those muscles. Or if people come to the gym and they're like, wow, my lats are so sore. And I'm like, wow, congratulations. I'm very happy that you're using your lats now instead of like your traps and over
yeah,
engaging your shoulder muscles. You actually know how to engage your back. Like, yay, let's
that's a
go.
good. We have a mutual friend of ours, someone you trained, someone that I have been seeing slash work with, who learned to compensate over a long period of time. She was a very good athlete at her sport, but learned to compensate.
Mm-hmm.
And she was the medical mismanagement of this patient had, like, it blows my mind, the fact that they were just giving her steroid injections at the age of 17, 18, and
Yep.
that the PTs just kept her on a plinth when she's a, college athlete. But I spent 9 months trying to help her relearn her body, which, we're getting her to her goals, but it's going to take, a decade's worth of learning a body, a different, like learning how to compensate and then learning how to actually use that. It takes a long
Mm-hmm.
time to retrain that brain and those pathways. But what I wanted to get at is, this was just something that came up where I was like, wow, I was like, you're not, we were just doing deadlifts, and she's like, oh my gosh, my back gets so sore. And we weren't doing a lot of weight. I was like, I know you're stronger than this weight
Right.
here. So where is this coming from? And then the same thing would happen with Carson, where I would watch her deadlift and she just could not increase her weight. And she would always complain, like, oh God, my back is just sore, but not anywhere else in the posterior chain. I'm like, what the heck? I'm like, I'm watching you do this and you've got decent form. I started noticing there was another PT that was looking at that I saw on Instagram, which can be such a wonderful place, but when it's not hot garbage.
Yeah.
Yeah, it made me really think about, like, there's some times where I'm very much a stickler on form. There's other times where I have to let people learn their bodies a little bit and just kind of
Right.
relearn that system, right? And she was talking about patellar tendonitis in a professional basketball player that she was working on, and was going through and racking her brain that this person had worked with very high level physical therapists. Like, we're talking highest of the highest level, who would only like nonstop work the quads, which typically when you look at a tendonitis, where do tendinitises come from? Well, we call it an overuse injury or a too much too soon injury, but a lot of times it's because the muscles that attach that tendon are not conditioned enough for the forces that you're putting on it. Basically,
Yep.
every basketball player will get some form of patellar tendonitis, whether the level of that we can't really gauge. Okay. Um, so she's going through it. perfect form with lunges, single leg, squats, jumping, landing mechanics, everything looked great. And then she started noticing that with single leg deadlifts that this person would lock out their knee. And she's like, oh, that's really weird. So then she started looking at hamstrings, very, very strong hamstrings. But then all of a sudden, you would see the wavering of wanting to lock out. And she's like, oh man, this is either a motor control or there's a weakness at the closed chain aspect of it. And so she retrained his deadlifting, specifically single leg deadlift. He was very strong in a double leg, single leg deadlifting, lost it all. And so would constantly go into the hyperextension. So I started looking at patients and this mutual patient of ours, and then Carson. And I started
technology. We ran into some technical difficulties, but we are back and just going to pick up right where we left off.
Okay, so we were talking about, I was looking at deadlifting. Okay, so what I started noticing with different patients, different people in the gym, even myself, was that cueing of that butt going back, right? You start to see that just a small amount of that knee translating posteriorly was almost eliminating that kind of hamstring pull that we want. So they would, though they feel it in their hamstrings, it was probably more of a stretch. You're putting more of a stretch on it. But what I started realizing that is as you're bringing those knees back, those hips continue to go back, right? And the moment arm then creates even more into the like low back rather than into the hips themselves. And so I started cueing. I cared less about kind of my cueing for hips going back. I'm like, hey, you need to keep these knees directly over your ankles. And whether I have to switch up that cue for everyone because that can be hard to do with an intrinsic cue. So I'd have to figure out some sort of extrinsic cue. And then more so focusing on that bending forward, getting that slight bend in the knee, but keeping that knee stacked because that's such like obviously the more that knee goes forward, you're going to create more of a quad dominant movement. As that knee goes back, you're going to create more of a low back dominant movement and kind of that Goldilocks perfect where that knee is going to create more of that hip moment. And so that mutual patient then comes in and she's like, holy shit, my hamstrings have never been this sore before after we just made that small little cue. And I'm like, yeah, welcome to using your hamstrings in a deadlift. But it started making, because like you're constantly as a coach, you don't want to over cue, you don't want to under cue, you got to figure that out for someone. But then you're also like, it just goes to show that when you're using the, are you feeling it where you're supposed to kind of feedback doesn't always work. Right.
No.
And so trying to find that happy medium for people, because, you had asked me one time, like, why is this happening with the deadlift of flaring people up? And I used to just be like, sometimes it's literally as much of a, hey, how long have they been off from the deadlift? Even a week, you're not going to be able to do as much weight. So I'd just be like, it might just be a load issue. And now I'm starting to think of, it's probably a mixture of, are we doing what we think we're doing with them? And two, are we helping them realize that their load is going to change? There's going to be days where you're feeling fucking great and you're ready to put up PR numbers. And there's going to be days where, holy shit, my brain is fried. Like for me specifically, like there's some days where if I have a caseload of like heavy hitters where it's like I'm a lot of persistent pain or just like sedentary individuals where I'm constantly racking my brain against them. By the end of the day, my brain is fried, and that's a lot of carbs that have been used that day. And so when I get to the gym, it's like I know I'm not going to be able to lift nearly as much as I want to. From a healthcare standpoint, I know that most everyday people, they just go, well, I need to do what I did before, or that's a failure for me. And that's where like,
or I need to ground and pound my body into the ground, because that's how adaptations are made. And a lot of people forget what you just said. And it's not that they forget, maybe they don't know, like common sense is only common to the individual. Like we have a deeper knowledge base than the common individual. And it's not saying they do or do not know that, but when your central nervous system, literally how everything talks to each other, it sends signals, it fires your muscles, all that, and your brain is really fatigued, and then you continue to demand more from it, and you are not fueling your body properly, like it's just like a recipe for disaster. Like, I don't mean to say like a lot, but it is a recipe for disaster. Your muscles won't be able to engage as much. You're asking for more of a demand on your body without the energy there. I feel like too, when you push through that, the pain that you already have is like almost more like louder exemplified. I can't think of the word right now because of how tired you are. You're not, then you're adding more fatigue to it. You're going and you're not really focusing on the movement patterns. You're just trying to get through the workout. There's a lot of factors that can go into why you're continuously having pain. And like you said too, a lot of people, not a lot of people, just in general, don't forget that not every day is going to be the same. You could come into the gym on a Monday and you're feeling really really great, and then Thursday you're feeling kind of beat up, so you work on breathing, you work on form. There's always something that you could be working on, and not just the amount of weight that you are pushing to feel adequate, to feel like you got a good workout, to feel that you're strong. There's always something that you can kind of work and tweak on. Like, you can always get better with your breathing, you can always get better with your bracing. You can focus on keeping your knees over your ankles versus pushing your hips back. There's little cues that can be very helpful to that person, like you said earlier. And with me being a coach, it's not the same cue works for everybody. Everybody is so different. And that's why it's like our brain, I feel like, is on constant, hamster wheel, because we're always thinking about, okay, well, how can I change that for this person? Or how okay, so maybe they're not getting it this way. What's a different way? Maybe I could do some banded deadlifts and no weight, or they need to be loaded more, or they need to have the bar off the ground so they can work to a certain stopping point. They need to have a band around their hips to help pull their hips back because they're keeping their knees over their ankles, but they're stopping their hips and reaching forward. There's always something that can be moving and grooving. And I feel like that's why PT can be very helpful for people, especially if you do group classes. If you do continuously group classes, and I'm not shitting on that, I'm only one person. Even if there's two coaches, there's only so much that you can do in an hour, and if
Yeah,
that
and
person,
God forbid
oh,
you have, a big class and you have a
yeah,
couple newbies, right? It
yes.
becomes difficult.
It just, yeah, it becomes difficult, becomes very challenging on your time management. And I mean, you're never going to catch anything, but that one-on-one time, whether it's PT, personal training, you can get to understand your body a little bit more. You can break things down a little bit more. And it doesn't have to be forever, but I do biasly think that everybody can benefit from some sort of PT. I don't know why when you split the body in half, it's the same on each side, but it does not work. It doesn't work the same. You have one side that's stronger than the other. You got that derpy leg. You have your shoulder that's, it's just kind of funny how the body is the same, but yet it's so different, and that everybody can benefit from kind of like slowing down and getting some like one-on-one time to make sure that everything's firing, like it should. There's some people that need much longer PT, and there's some people that maybe they don't have any pain, but they want some PT to make sure that everything's
For
moving like it should.
or I don't like to when I have people that use me in that way, I try to stay away from the, hey, this is how it should look, because sometimes in sports, lifting, in life, things look ugly, right? And so
Mm-hmm.
when we work on, hey, I'm trying to make you as efficient as possible, but you look at any professional athlete, power lifter, Olympic lifter, even CrossFitter, sometimes those movements get ugly, right? And so when I look at,
Right.
like, that's one thing, that there's fitness influencers and PT influencers out there that go like, hey, if you move this way, we need to fix it. And a lot of times it's, hey, sometimes it's because you're not used to moving that way where those type of injuries happen, right? And so,
Mm-hmm.
you're talking about pain and the different things that go into pain that most people don't realize. Most people look at pain and they automatically assume I have an injury, right? And
Yep.
what we know now off of now, over the past 5 years of where pain science is going, it's a lot more sophisticated and it's a lot more gray than black and white in that. And most people don't look at it that way. And probably because most physicians at this time, especially in this area, are about 10 to 15 years behind what pain science is. It's very frustrating on my end, but there's other factors that go into it. What did you eat that day? What are
Mm-hmm.
your electrolytes looking like? What's your stress levels like? Did something major just happen in your life? And it's just like, my whole body is on a fight or flight, and it has been because of it. What's your
Mm-hmm.
sleep schedule look like? Are you sleeping well? There's such a myriad of things that go into it. And how you had mentioned that like physical therapy is so much more, can be so much more, which is why I like to look at myself as a performance therapist rather than a physical therapist, because I think physical therapists now, thanks to places like Athletico and other larger entities in the Quad City area, um, they've given my profession a bad name, and
Mm-hmm.
it's really frustrating. So when you talk about like, hey, it's sometimes like when I look at 1031, for instance, and I look at some of the people in there, and you trying to cue all these different people who have ailments can be such a burden on because you're like, I want to help everyone, I
Yeah,
can't get
I
to
want
everyone,
to.
right?
Sometimes,
And it's
sometimes
that's
I'd be tired after I coach some classes back to back because I'm like, "What?"
For sure. And Austin and I just had this conversation. Like, like having a PT in house would make that a much, it would take so much off of your guys' plate, because here's the different ways that performance therapy can be used, right?
Right.
There's no matter what you do, no matter who you are, no matter how much of an expert you are at weightlifting, you are going to get hurt. It's just going
There's
to
something
happen.
that's going to
Okay.
happen.
There's something that happens. All of us have been through it. And the reason why we lift is so that your body is conditioned to be able to work through those injuries faster, right?
Right.
Besides the all cause mortality that it helps you with. And so where performance therapy comes into place is how can I help you get back to your training faster? Okay.
Mm-hmm.
How can we modify to keep you training? Because
Mm-hmm.
the more green weightlifters or fitness people or weekend warriors may just stop everything, right? And you
Yep.
don't have to, right? And so it's like I'm here to make sure that you continue, because for a lot of people this is our one way of getting our stress relief out, right? And when we don't have
Right.
that, things start to cascade. I'm here to help you stay in your stress relief, right? The other
Yep.
aspect is, okay,
Same.
what do we need to modify from a outside factor, right? And then how can I help you on that? And then working with the coaches to be like, hey, if they're having this issue here, here's the different modifications you can do, and working
Yep.
that way. The other thing is that maybe it's you're feeling a plateau, all right, and you're there's maybe a like off the top of my head, Chase, right? He's like, dude, I've been asking someone about my overhead mobility for years now, and every PT tells me you got tight lats. And he's like, I'm smart enough to know as a strength coach, I know I got freaking tight lats. I'm asking you as a professional, how do I improve that? Right. And so people like that, where it's like, hey, I'm trying to just, there's a goal that I have that right now I'm stuck on. And they
Right.
use me to help, like, hey, let's go through top to bottom. Where is something that we can start to tweak? And it may be a constant week by week. Hey, we're slowly kind of getting that right medicine to get you where you need to go, right? And I use medicine as a pejorative, like to tweak what we need to tweak, right? And
Right.
so I that is a super common use of performance therapists when it comes to like the suburbs and the city where people tend to be more active. Uh, you don't see that in this area because of that's just common in any kind of more rural area, though this isn't really rural, right? Like there's a pocket of a, urban kind of entities here. So when I look at like 1031, that's like the niche that I think would be super kind of helpful from a
I
coaching
mean,
standpoint.
absolutely. And to wrap things up, because we will be back, so you better continue to tune in because we have a lot to say, it has to be individual. Like it's very
Yeah.
individual. And it's not, yes, there is like a circle that we can, put people in, absolutely, box, whatever, triangle, whatever shape, but it has to be individual. You need to look at the individual, what they present. When I first started coaching, I'd be like, this is how you squat, and I'm like, well, I'm really glad I got out of that, because you have to look at the individual from the bottom up. What shoes are they wearing? What are their feet doing? How are their ankles moving? Knees, hips. You have to look at them and what they're presenting to you at that current time. It's great that you see their potential, but as a coach, you have to help them see what they are able to do now. Like, okay, I know that you want to squat 300 pounds, but you need to make sure that you're bracing to have the weight on top of your shoulders, helping them understand, like, okay, if they want to get a kip, they have to have mobile shoulders and a thoracic spine, because if they don't and they get up there and they push themselves, that can lead to injury. There's always an injury that can possibly happen if you are not focused on how your individual body can move and you're focused on just trying to get it and just trying to get through it. And there's a beauty in that relationship, and why I love the gym that I am currently at right now. And I will totally agree with you. There is something very unique about this with Austin's programming and what he's cultivating and the coaches that we have there, because we actually coach. And it pisses me off to no end when somebody comes up to me. And I mean, I get it because they're saying a compliment. They're like, wow, you guys actually coach here. And I just want to like scream at any coach that's a coach, whether you're part-time, full-time, half-time, anytime, whatever time you're a coach. Like, you need to understand that it is not a time to be friends with somebody. You can have a conversation and you can build that communication, but you're coaching the bodies that are in front of you. And you have to take that, you can't take that lightly, because if that person gets injured, it's not that they can't come back to the gym. It's that now, one, mentally, they're going to have a shitstorm. Two, you're making their life a little bit more challenging to get through. And then three, they might not want to trust you to work out, like, and come back to the gym. And so you have to continue to build that trust of like, hey, like, okay, so this happened, but if you come back, here's where we really need to slow down. Are you working with a physical therapist? Do you have a way, to maybe get some physical therapy in? Are you, like you said, sleep, hydration? Like, there's so many questions that you need to ask that person that has led up to that point. It's not just one thing. It's not your age, it's not your weight. It's not this. There is a accumulation of things that add up to get you to the point where you are. And a lot of people forget that. They're like, oh, it's because I got shitty ankles. Well, is it? Or is it because you wore 6-inch shoes the entire time that you've existed and you've never let your feet be feet? So then your body had to work a little bit harder to figure it out. And now you have shitty ankles because they really didn't have the best support. And
Yeah.
so, like, I like where you were saying that is, you have to ask them and continue to, get, well, not only ask them questions, but get feedback to make this assumption, to make these conclusions, versus like, oh, you stubbed your toe, you broke your toe. Here's some pain meds.
Yeah.
Make sure you move it around, and then there you go. It's not just a one size fits all. It never hasn't been. It never will be. I mean, yes, there's data collection on a group of people so that we can have maybe an idea, but it will always and forever be individual. And when we can really grasp that concept, then you have a bigger edge on things. Even in group classes, it's still individual. I tell the people that workout's for the whole gym, not for you. And the
Hmm.
more that you can understand, okay, like, I'm feeling like shit today. Maybe I need to go lighter weight and just move my body. I'm feeling really good today. I want to try heavier weight, but I'm going to be a lot slower because I need to focus on these things. Like, there's always something that we can be doing.
Listen, what you guys do as strength coaches that sets you apart from the rest of the injury is that you're not trying to sell them workouts, right? You're not trying to sell them like the results are, hey, we're here to make you better, right? And I think that's a lost art in our industry, and it just makes you guys come off way more authentic.
Yeah.
And from a standpoint of like, you show that you truly care about what happens to the individual, right? um I don't know, it's a nice it's refreshing. It's you let your egos to the side. I think one of the best things that we can do, and I have to constantly check myself, is that I got to put my ego to the side, and sometimes just let your clients and your patients tell you what they need,
Yeah.
because there's so many people that are so stuck on what they feel like is the best way, and they're constantly being fed that. And they should realize, like, hey, if you like, you're going to tell me. Most of the time when I let people just flow. When I'm having evaluation, when I'm asking them questions, I let them flow. I ask very open-ended questions,
Yep.
and then as they lead me to where I want to go, and then I'll get more pinpoint. And
Yep.
they basically dictate their own treatments. And the same thing can happen in everyday life. And so I think that's why people come there, because you're exactly right. When you don't listen to them. Two, you try to force feed them, and say something does happen to them. Not only are they probably not going to trust you very much, because like we said, you're going to get hurt. And sometimes there's other factors that go into that, but you've already created that trust with them, right? But when you
Yep.
don't create that trust and you're still trying to force feed things with them, you may have just created a barrier into fitness for them, because now they are petrified of that re-injury and things of that nature. So
Hmm.
it's like I think that's a lost art, to allow people to kind of dictate their own pathway. And I
Right.
think that's where I'm hoping we can start to change people's thought processes on, one, physical therapy, but two, healthcare in general. That, like, hey, you have a right to dictate what you do. There's going to be some times where there's nothing, the cards fall the wrong way, and we do have to use some sort of medicine, surgery, things of that
Yeah.
nature. But a lot of times there's more than one way to skin a cat, right?
Yeah.
Uh, and it's sometimes it's just time. You got to allow your body to take that time, and that education piece becomes even more. But allowing that patient, that person, that client to be a part of that becomes so much more important.
It really does. And that's a great spot to end on. We're not going to tell you, what choices to make. A lot of times both of us, we just ask questions because you can dictate your own direction, and you maybe just need a little guidance in the direction that you want to go. And it's always just trying to help. And even with how awesome 1031 is, we still miss the boat on a lot of things. And it's not to say that, we know it all and I have all the answers, but I can tell you one thing: if you want me to help you, I will do what I can to get you an answer or direction to go in. But remember that it's not just a one size fits all approach. It's very individual to you, because we are all unique humans. And no matter if we have the same goal, the approach that we're going to get there is going to look completely different. So work on, as you grow as a human in your fitness world, your life world, whatever world, that you work on not comparing yourself to others so much, but seeing what is possible, opening your mind to what is possible, seeing fitness differently than a way to, um, stress your body out more and beat it into the ground, in a way to honor your body and see what's possible and show your strength and your skill levels, but not be afraid to take a couple of steps back to continue to rebuild or build your foundation. Any last words that you want to leave our listeners with, Max?
Yeah. Just kind of pigtailing off of what you just said, I would love for, your listeners to understand that we're here to help, and that, you don't, when you're in pain, you don't need to bash your head, that there's people out there that do want to help you reach your goals. I'm there for questions. Like, you can reach out to me. I love to help. I love to try to figure out the puzzle. And you're gonna guide me as much as I'm gonna guide you. And just remember, like, there are people out there that care about your well-being, and we're here to help. So
Absolutely. And then in the show notes, there will be a couple ways that you can get a hold of Max if you want to follow him on the socials or just reach out to him. Like he said, same with me. We love to help you out. If you have questions and you feel comfortable reaching out to us, there is no stupid question. And if you think that question's stupid, probably many other people have that exact same question. So thank you again for tuning in. As always, we greatly appreciate you taking your time to listen to this. Your time is very valuable, very important. And we just cannot thank you enough for wanting to listen in. If you like our podcast, like what we have to say, please share it on social media, tag us in it, and make sure to tune in the next couple of weeks because we have some good stuff coming for you. Thank you all.
thanks, Shelbs.